Welcome back, everyone. For this lecture, we're going to discuss acute hematologic emergencies. While some of these emergencies are indeed rare, they can certainly be life-threatening and are worth discussion, and you should be aware of to be able to recognize some of these diseases. The first that we're going to talk about is something called DIC, or Disseminated Intravascular Coagulation. There are a number of causes of DIC, but it carries a very high mortality rate. It occurs in two stages. You have free thrombin and fibrin deposits in the blood increase, and then defibrillation occurs. And this leads to uncontrolled hemorrhage, and this is essentially free bleeding throughout the body. You need to identify any associated signs and symptoms with this patient and understand that these patients may have significant respiratory difficulty, extreme signs of shock, as well as extreme skin changes, and particularly related to the perfusion level. You may see hemorrhage from any of the osses within the body, so eyes, nose, mouth, etc. Management for these patients are ultimately geared around identifying and correcting the underlying cause, but for the pre-hospital provider, we're going to try and maintain an airway oxygenation and circulation the best that we can. It may require aggressive airway management and oxygen therapy, as well as significant pharmaceutical interventions for shock. This DIC patient is certainly going to be a patient that, if you're a basic level provider, you should be requesting ALS backup for and rapidly transporting to a definitive care facility. If the patient is in a significant level of pain and you are at a provider level where you have pain management available to you, you may need to provide pain management for this patient, as well as watch for any cardiac abnormalities or cardiac dysrhythmias and treat accordingly. Hemophilia is a bleeding disorder in which clotting does not occur or occurs insufficiently. There are two primary types, type A, which is low level of factor 13 and, factor 8, and type B, which is a deficiency in factor 9. Hemophilia A is hallmarked by things like nosebleeds, bleeding gums, heavy menstrual bleeding. Blood may be present in the stool or urine, as well as hemoptysis, or coughing up or vomiting blood. You can have acute or chronic bleeding. These patients are at risk for spontaneous intracranial bleeding, and patients may require hospitalization for transfusion or infusions of factors 8 and 9. Make sure we assess and manage ABCs for these patients. Be alert for any signs of acute blood loss and any need for fluid resuscitation for advanced level providers. Note any bleeding of unknown origin, and also watch for signs of hypoxia as we reduce the blood carrying capacity, or the oxygen carrying capacity of the blood. We may end up in states of hypoxia. These patients will likely need high flow oxygen. Note any ECG findings if the patient is on a cardiac monitor and you have those capabilities. IV therapy and fluid boluses may be required, and analgesics for advanced level providers may also be appropriate. With a reduction in blood volume, make sure that you help the patient maintain body temperature, so you may need to cover the patient and keep them warm. Transfusion reactions are not necessarily common, but the most common complication of a patient undergoing transfusion. And while you'll not likely see these patients in the pre-hospital world, when you're doing interfacility transfers, or if you're working for a critical care service, it's not uncommon to transport patients that are undergoing blood transfusions. It's also worth noting that the whole blood products are becoming more prevalent in the pre-hospital world. So if you are working with a service that's offering whole blood products or blood products as a treatment for hypovolemic states or trauma patients, then this may also apply to you. As far as the pathophysiology goes for transfusion reactions, this occurs when patients of two different blood types are given. It's specifically related to the Rh factor on the blood most commonly, so positive and negative, or cross types. And you can see a table here where you've got donor and recipient blood types, and it shows you what is compatible. So O negative is the universal donor. In other words, all blood types can receive O negative blood, while AB positive is the universal recipient, meaning that a patient with AB positive blood can receive AB negative, A positive, A negative, etc. And you can see here where the table goes for ensuring that you have the appropriate blood types. Reactions can occur rapidly and may cause circulatory collapse, and you should monitor patients that are receiving blood transfusions, especially for the first 30 to 60 minutes. You can see here is a breakdown of kind of what occurs during a transfusion reaction. Some of the complications that we see are things like hemoglobinuria, things like renal failure, acute vasoconstriction, and you may even see things like a classic sort of urticaric or anaphylactic response or allergic reaction response. Symptoms can be subtle, especially if they're unresponsive and intubated, and reaction symptoms can start with very mild presentations, such as things like tachycardia, chills, back pain. Complications include things like hemolytic reactions, febrile reactions, where the patients start to run a high fever, allergic reactions up to and including anaphylaxis, circulatory overload, and others. The hallmark for treatment of transfusion reactions is to stop the transfusion. So if there is a transfusion reaction occurring, just like if you were giving an infusion of medication and the patient were to begin to have a deleterious reaction to that, the immediate treatment is to stop that infusion and then provide hemodynamic supportive care and maximize kidney perfusion. You may need things like serial fluid boluses for these patients for advanced level providers. And if the patient is anaphylactic, treat accordingly. Early invasive monitoring and vasopressors may be needed, promotion of diuresis, and for basic level providers, make sure you want to stop the transfusion, administer high flow oxygen, and treat symptom support accordingly.